Thank you for joining us for hashtag UnWokeID 2022. This conference is going to focus on unethical issues in contemporary international development and policy and practice. My name is Dr. Jessie Hansen DeFusco, and I am joined by Dr. Camila Morales from the University of Texas in Dallas. This conference is funded and supported by the Office of Research and Innovation in partnership with the School of Economics, Political and Policy Science, as well as the International Center. We are also working in collaboration with the Harvard Alumni for Education's Sub-Saharan Africa chapter and the University of Pittsburgh's African Studies Center, as well as a dozen other partners who work in international development research and practice around the world. Thank you for joining us.
Welcome. I am Dr. Inga Musselman, Vice President for Academic Affairs and Provost of the University of Texas at Dallas. We thank you for your participation in our virtual conference, hashtag UnWokeID, Ethical Issues in 21st Century International Development Policy and Practice. UT Dallas takes great pride in our institutional mission to support diversity, inclusion, and social justice worldwide in a variety of ways. The university offers an array of diverse academic and research opportunities with a large international student, faculty, and researcher population. At the heart of our work, UT Dallas provides the nation and the world with excellent, innovative education and research. The university, while striving to improve educational and research programs in the arts and sciences, engineering, and management, is committed to mentoring active citizens whose education has prepared them for rewarding lives and productive careers in a constantly changing world. Additionally, as a Tier 1 research institution, we are committed to using our reach to uplift the voices of diverse perspectives to make the world more just and equitable. In collaboration with UT Dallas's Office of Research and Innovation, the School of Economic, Political, and Policy Sciences, and the International Center, this inaugural conference will bring researchers and professional practitioners together with special focus on representation from the Global South. We have guest speakers from all corners of the globe, many of whom have devoted their lives and professions to making the world a better place, especially for the most marginalized and vulnerable through international development and nonprofit. Our featured presenters will share their expertise on critical issues such as violent, coercive, or paternalistic policy and programming in international aid, unethical practices in international development partnerships between international stakeholders and national partners, unequitable representation, concerns of limited or ignored voices and perspectives by host national and regional development experts, nonprofit workers, and beneficiaries, and the struggle for transcultural and multicultural perspectives in the promotion of globalized human rights and a globalized economy. The purpose of this conference is to give voice to practitioners and researchers from the Global South and to collaboratively advance a scholarly dialogue that may help inform vital change to contemporary policy and programming in low-income regions. This conference will be broadcast live on the university's Microsoft Teams platform. The presentations will also be made available on our website for wider audience viewing. Thank you for taking part in hashtag UnWokeID.
Good morning. I'm Dr. Jennifer Holmes, Dean of the School of Economic, Political, and Policy Sciences at the University of Texas at Dallas. Welcome to our innovative conference, Ethical Issues in 21st Century International Development Policy and Practice. EPS has a mission to create leaders to tackle the challenges facing our society and economy, both here and abroad. EPS faculty pride themselves on a commitment to teaching and research, including fostering international partnerships to address our mission. Thanks to the support of the Office of Innovation and Research, our faculty are partnering with nearly a dozen researchers and practitioners from over 4 continents to discuss ethical issues in international development. The United States invests billions of dollars to support improved governance, stronger democracy, and higher quality of life for the most vulnerable around the globe. Yet more can be done with strong bilateral and multilateral partnerships and authentic collaboration with civil society and grassroots actors to foster improved policy and practice in the field of international development. Today, we welcome scholars and practitioners from the Global South to address these issues and to interact with our students. Welcome.
Thank you for joining Day 3 of the first annual #UnwokeID Ethical Issues in 21st Century International Development. This conference seeks to expand the dialogue of contemporary issues that potentially still exist in international development today. Yesterday, our guest speakers were professionals working as practitioners in the Global South in countries like Benin and Liberia. Today, on the last day of this 3-day virtual conference, our speakers will include Global South experts in this field who have worked all around the world and will share with us firsthand their advice about how international development can progress. Our first speaker today will be Sakil Malik. Sakil Malik is a senior executive for global programs and operations, where he's raised and managed over 250 million funds in global programs. He's designed and implemented programs in over 75 countries, prepared strategic scale-up and international plans for 300 NGOs/CBOs globally. He has trained over 500 professionals on global project management and research. He also teaches as an adjunct professor at University of Maryland. His expertise includes knowledge of global, cultural, political, economic, and social issues. He is fluent in 4 languages: Bengali, English, Hindu, and Urdu. Sakil has nearly 30 years of nonprofit experience, including working with large-scale international nonprofit organizations like DAI and World Learning in high-level leadership positions. Sakil Malik is a highly regarded expert in the world of international development. Born in Bangladesh, he advocates for inclusive and strategic partnerships and the evolution of transparency and collaboration in the world of grants and human resourcing. We are honored to have him as our special guest speaker today.
Good morning, good afternoon, wherever you are in the world. My name is Sakil Malik. I'm the CEO of Global Center for Innovation and Learning in Maryland, USA. And I'm really delighted to be with you today to talk about some complicated, not so complicated issues that we are facing today in international development. And really a little bit about myself. Maybe you already read through the speaker's bio. I am in international development for about 25 years, worked more than 70 countries around the world in many sectors, in program design, program management, and evaluations, in policy and also implementation. So today, when we want to talk about international development, first thing I want to go back a little bit of on the history of the international development and kind of colonial thinking. The idea, of course, many of you are very aware, really when international development took shape in 70s, and many literature says this in explaining how really the good heart folks like us who were very interested to help others. And the idea of helping the South, where a lot of developing countries and communities needed, economic resources and also other supports. Many times this international development work started with the humanitarian ideas in mind, but really then moved into not only humanitarian, but also contextual, sectoral development programs and projects in many, many countries. And the continuation of the international development program cycles, creation of new donor communities, many donor communities, for example, the government, bilateral donors, multilateral donors like World Bank and ADB and others. And then there are many different other aspects of the development donor community, which is foundations and corporate social responsibilities. And even you can see now internal or community-based fundraising and development programming happening in many, many countries. The idea that I want to first emphasize on is really the question comes up, is our international development programming and implementation is equitable and inclusive? So the idea is that the imperial thinking of colonialism actually influenced a lot in the development thinking, because whether intentionally or unintentionally, you have seen that many times there was a giving in development, and there were receiving in the development, and really a lot of ignorance and also ignoring the fact that the communities that we are working in or want to work have their own civilizations and much older civilization than ours in developed countries. And these civilizations have survived and with resilience and also knowledge that they carry for their own development and structures. So, for example, I will give an example of my own native country. 1453, the year 1453, the financial GDP of Bangladesh, that was at that time, there was no Bangladesh, there was larger Bengal, was $70 billion in today's currency. So the point is why East India Company from England would come and build an office, offshore office in Calcutta. And it was not because they wanted to really, do good to the Bengal. Rather, there was international trade and financial benefit. Very purely, there was the first economic reason for coming to a place where there were ports, there were river access, and the access to all sorts of roads and also waterways, and also it was very fertile land. So the reason I'm giving this example is that it's not out of blue that colonialism actually started to reshape the thinking from the 1600s or even earlier in the human history. The idea of in recent international development programming and design, I'm going to highlight on a couple of issues, especially design phase and then the implementation phase. And this is really important to think about very crucially and critically, because in a design thinking, there is a lot of words, of course, are used: participatory development, there is supply-driven development, demand-driven development, all sorts of definition you can also study and research. But the idea is it true? Is it true for implementers or the donors really, ask the community and what they want, how they want it, when they want it, are they part of the decision-making processes? Now, the community also include the higher tier, meaning the administrative offices and the government structure and the governance in the country. Not only talking about the donors or the bilateral or multilateral donors who are from the other side of the story. Now, even if you think about maybe many countries do talk about colonists did leave, 50 years ago, 30 years ago, and we became independent country. But then the point is, did we leave, meaning colonists leave the local colonists? And you can see many development models now in the country are really organized and implemented through the government systems. You cannot really bypass the government system when you want to do larger reform in the country. And there is huge corruption in the development programming and implementation, whether this is infrastructure project or there is sectoral one, and it could be any sector, energy, education, health. There are huge corruption information that comes out from these programs. Now, the point is it the donor's fault or is it the implementer's fault? The point is there are policies. Some places there are policies for really solid accountability and evidence for the donor and the implementer, but then are those being executed? So there is financial side, which we of course always worry about a lot, which is financial corruption. But I also would want to bring your attention to another issue, which is data corruption. Huge data corruption. When we are talking about the fidelity of implementation and what we originally intended to do in the community on the health project or in the education project or agriculture project, is it really producing what we intended to do? And how are we portraying the data? Now, a lot of time, the governments and the donors are both involved in the decision making and the implementers, and that how the data would be portrayed. Now, this data corruption is also a huge issue for the development, equitability and accountability and inclusiveness, because if we need to be truthful to ourselves and see whether the data is saying the truth. If there is no success, then what is the issue and what are the issues that we cannot say that the project did not succeed? And Jesse and I talked about this a lot of time. I remember that there is no failedproject.org website. Nobody wants to talk about failed projects because those are bad for our reputation and bad for our future business. But there are so many failed projects around the world. Money has been spent. The data shows very clearly that in the same country, one after another reform program happened, and almost exactly the same data coming out saying that there has not been any progress. But still the same implementer getting the resources and the same donor is paying for those programs. So the point is, what are these, are these really development? I asked the question, which is fundamental. What does development mean at all for us? Is it progress, or is it really flushing the money out that part of the global politics or foreign policy or bilateral relationship, we need to provide resources and to have control, to have the regional presence or whatnot. So I bring out this question because these are not discussed a lot. There is also equitability issue and inclusive issue in the non-profit and for-profit development agencies. So, a lot of non-profits struggle. They talk about, financial resource issues, but also I bring a question about the board, the non-profit boards, who are really well-known people in many non-profits, and they are supposed to have fiduciary responsibility. Now, the implementation and the policy design of that nonprofit, when we look at some examples, there are really interesting, situations in many nonprofits that they are not equitably paying their staff, or there are serious gender issues happening. They are not inclusive policies, and still, also there is no representations of the minorities or people with disability, or and then totally forget about the Southern representation. Now there may be a token representation of the minority in the board or the staffing, and that's what they would say, okay, the box is checked and we are really equitable and inclusive organization. So then the other piece is the implementation side. You might have really fantastic policies that are developed and prepared at the headquarter level with a lot of consultation and discussion, really well participatory processes. But then when we go and do the implementation in the field, are we actually following those inclusive policies in the project implementation in international development? And a lot of time also there is blame on the southern countries' own governance structure and also the cultural norms. There are gender bias and disparity, and of course now added to that is the digital divide, and that oh, they don't have the technology, they don't have, they actually abuse their women and minority in those countries. So what are we supposed to do? Now, zeroing in or minimizing the standard is not supposed to be the marker for our development philosophy. As development professionals, I think we all agree on the highest level of ethical standard. We agree on highest standard for inclusiveness and really doing good with the right accountable processes. So minimizing, going with the minimum standard, which is also another word that I totally disagree with. Why are we compromising with minimum standard? There are a lot of global documents which actually says minimum standard for this, minimum standard for that. My point is, when we are doing our own development programming in developed countries, why are we not saying that? The minimum standard for X, Y, Z. We are only saying minimum standards for developing country context. And the idea that they only have to do the minimum standard, maybe because they are not capable, or maybe we only gonna be funding them for a very specific time, and the minimum standards only could be achieved. Another piece I want to bring to your attention for discussion, and I think this is another crucial issue, that from the donor side, most of the bilateral donors and multilateral donors, these are public money. So the accountability issue for public money, we all should have access to everything, all documentation. I really mean it, from the RFP to the proposals that are being implemented, the project plans, work plan, everything should be public in my mind, because this is supposed to be anything that is provided through public money. The citizens have right to have access to that information, and there should not be anything to be hidden. And the idea of data now is in a different place. The data-driven decision making only could be done, which is supposed to be from the citizens' point of view, that I can only take my decision about my constituents and my global policy as a citizen of the country only when I have enough data to make decisions based on those data. But the data is not available, or the data is not accessible, and I'm not supposed to have data available to me, because then I will have opinions, and opinions are being formed to have democratic environment, and the democratic environment is not encouraged. So it is all connected with each other, and a lot of policies actually discourage data sharing, and the contracts also does discourage data sharing publicly. I'm talking about both sides of data, the program data, also financial data. So I think these are really crucial topics that we think about. There are examples from East Africa, West Africa, Southern Asia, East Asia, even Latin America. And don't forget our own places, for example, the Native American communities or inner cities where programs are happening in the same way. And these accountability issues brings to the question of how ethical and accountable and inclusive our development practices are, and how could we really change our mindset and our policy and our implementation, that it is not really, Western-driven development models. Rather, it's a collaborative process. And I also personally disagree that there is a conflict of this new model that we are thinking about or discussing, which is really collaborative development model, because which actually a lot of people say that, if mission is accomplished, your mission is accomplished, then development programming would stop. The roles might actually change of the development agencies and the development partners from the north, and the development model would also have new roles for the agencies and implementing partners in the south. And you actually see the model really work well in business side or manufacturing side or for-profit industries, private industries, but you don't see that shift happening in the development sector in that way. So there are some good examples of really the communities driving their program ideas, and the donors are invited to provide support as and when necessary, and really a lot of technical support on knowledge sharing and data management, data-driven decision-making processes, and it's a facilitation role rather than actually getting into the community and say, we know how to do this development for you, and then implementing it with a very small project cycle of 3 to 5 years. So, there is also this issue about the last topic that I want to really highlight on is really the project cycles, which are very crucial topic to discuss, because the project cycles are not always aligned with the government's regime cycle. And I mean it. What I mean by that is that there is regime changes in the middle of the project time or project cycle, and then all the hard work we have done to really have a good alignment with the government policies and the structure. When a regime change and the administration changes in a given country or the donor side of the country, complete policy shifts of the global policies, foreign policies, even the funding might dry up in that particular sector, or the projects are being realigned with the new philosophy, or the local governments in southern countries, they also have a very high rate of changing or shifting their specific target in the sector. If the previous government was interested about agricultural development, the new government might say, I'm only interested about infrastructure, not interested about agricultural development. So the money shifts, policy shifts completely to the other side. And all the projects that we're working on and maybe had really good results and impacts really goes through the roof, and nothing really impacts the development of that community, and lost resources, lost efforts, lost initiative. That's something we really cannot afford, because resources are limited, not only financial resources, but time. Time is passing through. I remember a long time ago reading this book called 50 Years is Enough. Is 50 years enough? And after 50 years, we are still seeing many countries are still in the same place where they were. So with that, I would like to invite all of you to really continue this conversation and welcome these complex, difficult discussions about how could we really make development ethically highest standard, accountable, inclusive, and really collaboratory processes, rather than the way that we do our development business. Thank you so much for your time, and really appreciate all your enthusiasm and discussion. And thank you, Jesse and University of Dallas, Texas, for inviting me to be part of this wonderful and very important timely conference. Thank you.
Up next, we'll hear from Vijay Palmer. Vijay Palmer is a practitioner with over 25 years of social and economic development within and outside of the United Nations, covering a range of country contexts from crisis, early recovery to emerging donor status across Africa, Asia and the Pacific, Europe, Americas, and the Middle East. He is an accomplished business program and policy advisor in both the public and private sectors, with over 25 years of experience in leading and developing transformational change, programs and business opportunities at global, regional, and national levels. Vijay has led and been part of senior program teams in various areas from UN joint strategies, policies, events, resource, and stakeholder management. Vijay has strong hands-on experience in operational knowledge management, evaluations, and reporting. Our next speaker of the day is Dr. Joe Matengwa. Dr. Joe Matengwa has 15 years of experience in international development, implementing and leading complex health programs across development and humanitarian contexts, including in sexual and reproductive health and through gender transformative approaches. A medical doctor by training, Joe has worked as a medical officer, medical team leader, and medical supervisor in fragile settings such as Sudan, Haiti, and DRC. He has a flagship multi-country program in the area of maternal and adolescent sexual and reproductive health. More recently, Joe has worked as a senior regional sexual and reproductive health technical advisor. He has also co-founded the African Sustainable Development Advisors Incorporated, which provides technical support to African local organizations and government bodies. Joe has a medical degree from the University of Lubumbashi in DRC and is a master's candidate in international cooperation and humanitarian aid at the KALU Institute.
All right.
You ready?
Yeah, one sec. My computer just froze. Ah, come on.
It's the law of the jungle.
I know. Give me 1 second. Of course, it's
Right.
like having a full freak out. It's like, what have you done? All right, there we go. It's
You
recorded.
ready?
Yep.
Recording in progress.
Got it.
All right, I want to say thank you so much to Vijay for being a guest in this conference. I'll let you introduce yourself and then give you the floor, sir.
Yeah. So, hi, my name is Vijay Palmer. I'm what we call development practitioner. 25 years plus in the UN system. Started off actually ironically in the world of advertising, then became an economist, and then through various projects in the UN, I have worked in Africa on ICT for development, Asia Pacific. Come back to the UN in New York, worked on partnerships, evaluations, and then done recently a lot more crisis management, Liberia, South Sudan, Sierra Leone, Ebola, recovery, everything. So the full gambit. Now I'm working currently in Bahrain and back in New York on strategic alignment and developing SDGs and youth development. And prior to that, I had a long stint doing on South-South Technical Cooperation, working on cooperation between Asia and Africa, Middle East and Africa, and most recently Europe and Africa. So the discussion should start off with where we are at present. I think if you sort of put it in the context, and as the Secretary General himself came out with a long message and a statement on what to do post-COVID, even if we get to that point where we now are thinking about what do we do after we've dealt with COVID. COVID has shown the global world of isolation. It's shown the divisions that were apparent, but now glorifyingly apparent. The economic diversity and divisions between the North and the South are huge, And that's been shown and paralleled by even just the medical impact. So much of the population that is being sort of vaccinated is predominantly in the north. The south is starving, I think is probably a better word for it, in terms of vaccinations and access to vaccinations. And that's just shown, the other problem or the other issue that COVID has highlighted is the economic markets and also the dependency of people working in the formal sector and those working in the informal sector. As the COVID has shown that the people who are living in developed countries, who had access to public support, predominantly in the north, were able to access funding, government funding. Those who are in the south, even in countries as what we call middle income countries like the Philippines, people lost their jobs, especially those in informal sectors. Those in Africa who were relied on the informal sector were stuck at home with no income, no nothing. So there you have the diversity that has been shown and the huge gap, not only in economic terms, but in health terms, but also social protection. South Africa had to go as far as stopping the selling of alcohol to protect the women at home. The gender-based violence, which, the real figures will come out in the future. The real impact of COVID beyond health has been social protection, and for many women in developing countries didn't have social protection that was afforded to people in the developing countries, those in the north. From simple judicial systems, from police forces, to other factors, the woman at home was left on her own and was prone to many abuses. Whether it was the fact that any income she earned was directly taken by her husband, there was a lot of mental pressure. So the divisions between the South and the North has just been highlighted even more by COVID and the impact of COVID. So the question is, how do we go forward? I think what's been shown, and something that we've been working on, or I have been working on, well, we, when I say we mean the role we, the UN, the development practitioners, and when I say development practitioners, that means everyone, from your international NGO to your community-based NGO to your national NGO to your academic universities. There's now a growing recognition, and the best example of that has been the fact that you've not been able to get over the patenting or the licensing of the vaccine. Up until recently, the big pharmaceuticals who are funded, ironically, by government funds, by the diaspora, actually many people who come from southern countries, who pay their taxes, who are helping governments find the pharmaceutical solution. The pharmaceutical world of the North has been very harsh and up until recently resistant to sharing the patents and the vaccine formulas. Just recently, South Africa has won the right to do its own vaccines on the ground. So that just shows one thing. And the irony of all of this is that if it wasn't for George Bush and the people who've been following the history of HIV/AIDS would fully recognize the impact that George Bush himself, Junior, not Senior, Junior, had on the fact of introducing and breaking the patenting of HIV medicine in South Africa, which has led to many of the recognition that the South needs technical assistance. And that's a good example of South-South technical cooperation. If we are to move forward, if we are to achieve the SDGs, if we are to reduce the gap between the South and the North, not only in terms of technical expertise, but also economic expertise, social protection, judicial systems, there needs to be a much better exchange of people and ideas. Then we can no longer live in the world of patented and IP, intellectual property, only being in the North. It has to be shared with the South. The irony of all of this is, if you look at most of academic institutions, if you look at most research centers, if you look at most patents, there's a strong element of people from the South who originated from the South, who came to the North, to those academic institutions, whether it's a university in Dallas, whether it's a university in the UK. People came from the South and have studied and made the North a better place, academically, and in so many ways. But now is the time, and you see it. I mean, the great joke back in America was when you had before the Wall Street crash kicked in, the tech companies, a lot of the Indian employees in the tech companies were going back to India. The joke was back to basics. I can't remember too much, so do excuse me on that one. So B2B was back to Bombay. So that was the joke. So that whole HIV, the whole visa system, everything, just highlighted, and what you see now is a growing strength in what we call the BRICS. The BRICS is Brazil, Russia, India, China, the leading, what we can call developed to middle income countries, which are leading in South Technical Cooperation. They've shown the light, not only in the world of financing, but also in the world of academia. If you look at the southern universities, if you look at Africa now, if you look at South Africa, Witwatersrand, if you look at Kenya, there's some good universities which are now sort of tapping on the doors of academia, and as well as the UN system and the usual suspects when it comes to doing academic referencing service, that you don't always have to go to Harvard. You can do the research within country. There's a lot of people who good example is someone right now in your campus is Jess, who was in Liberia. She took it upon herself to reach out to the University of Liberia to do work. We know many people between ourselves who, whilst working in Liberia, have reached out to the universities in Liberia and led the way in showing them the light. Okay, you can do things in a better way. And Zoom, ironically, of all things, Zoom has shown the world that if we are to have one, must remember the origins of the internet. When we were developing the internet in Africa, when we were developing the internet in Asia Pacific, one of the great arguments that we were using, that we meaning the UN, we led a number of conferences and events to convince the African governments that you need to get onto the bandwagon of the internet. And the whole argument then was that we can use the internet to reduce travel. There was no need the government's the opportunity to save on airfares, to save on ministers traveling. And it's ironically, it's taken COVID to show the world of how remote working is and supposed to be. Remote working is not always the best way to do things. You still need a human feel and touch, but it's an answer to a solution that was required to keep the pace of varying. So in understanding where we were to where we are and the way that we need to go forward, the way forward is really in terms of greater South-South Technical Cooperation. And it has to start with academia. Academia has to be the bedded foundation. Academia has to be the land of innovation. Academia has to be the land of education. The one thing, Jess will testify to this. Those of us who survived the Ebola crisis or worked in the Ebola crisis will tell you that the aftermath of the Ebola was there's a generation. And in countries like Liberia and Sierra Leone, it was even worse, that the civil war had hampered education by generation after generation. There were adults in Liberia and Sierra Leone who, due to the war, had missed 10 years of education. 10 years. COVID has led to a significant academic gap. There's going to be a generation in the future that will not have had that sort of face-to-face physical interaction. A large part of going to school, whether it's your university campus, whether it's college, is that human interaction. That's that social character building there's going to be a gap, and that one point will have to be addressed. Now, how does that affect Zoom, and how does that affect South Technical Cooperation? South Technical Cooperation is that academia presents the opportunity for the academic universities and the universities to work together, but not only do the innovation, but also improving social interaction by facilitating students who can't physically or financially afford to come to northern universities. And I say northern in not just the geographical context, but in the context of those universities in developed countries, to have access to students who are studying, to give students in the North the opportunity to understand and innovate, as well as come up with ideas together. There needs to be an innovation on both sides of the equation of the coin. In that sense, there needs to be a technical exchange, and the whole word is exchange. Exchange, whether it's exchange virtually, whether it's physical exchange, or whether it needs to be an innovative program of ideas and sharing. Microsoft, Google have all given us applications. Zoom has given us applications. The cost of internet has given us an opportunity. But however, let us not shy away from the realities of people in the South and the financial costs that are implied and the technical costs. You know, for those of us who live in the North, you know, we have access to electricity. We have access to the computer hardware. We have access to computer software. We have access to a lot of stuff that the South doesn't have access to, but they can get by. You know, they get by, and amazing innovation is there. So how do we build this bridge of innovation? And academia has to be the bed. Academia has to be the bed that breaks the intellectual property barriers. We have to break the intellectual property barriers. We have to bring back freedom. The internet, as I was trying to stress before, has shown that there is no control of intellectual property rights, realistically. If you are going to sue a libel case, good luck. If you're going to sue someone in India on intellectual property rights, we have plenty of examples, even to Australia, where people have opened up a supermarket called Selfridges. And the Selfridges in the UK have tried to shut them down. Those days have to be over. That's the colonial mentality that we have to break. We need to have a foundation of academia. We need to break the intellectual property rights and the colonial rights of it. An idea is an idea. Unless you've created something, nothing is new. The only difference is that you were able to do it and someone else wasn't able to put the idea into motion. So now we create a foundation of academia. We need to be creating more of exchange. Zoom and things, remote working is showing how we can work with each other in different parts of the world and overcome and provide solutions to what are global challenges. The weather is a great example. And one of my great lines is, you can fly first class, you can fly economy, you can fly business. But when it comes to baggage claim, it makes no difference. And this is the same with global warming. You can live in a mansion, you can live in a hut, you can live by the sea, you can live inland. Global warming means you can no longer hide. Unless you're Elon Musk or someone who's planning to go to Mars, but even then, you still can't avoid the global challenges the global climate presents. So we have some real serious challenges, and we have to work together in providing a South-South technical approach. Academia has to lead the way. Academics must have the freedom of expression. I don't want to use the word woke, and I don't want to use the fear of being challenged on assumptions or something. We need to have academic freedom. We need to have people like Jess leading the challenge of bringing people together and giving people the free space to talk. But the most important factor is financing. At the end of the day, financing really helps to take the proposal or the agenda or the project forward. And that's where we need to work innovatively in finding financing from the South, through diaspora, through universities, through governments, through the foundations, through tech entrepreneurs. There is a large skill gap which is going to be happening in the North. The Japanese have woken up a long time ago to the fact that they have an aging population and they don't have the youth to look after them. Most countries in the North don't have the youth that will be there to look after the aging population. Added the factor is you don't have the food. Food security is going to be a huge problem in the future. If you haven't seen it, it's coming. People are now seeing Africa as the bed for agricultural development. Even people in the Middle East have recognized, and if you've been following any of the news, you would have seen the UAE, the Saudis, and even Mr. Bill Gates himself has been buying loads and loads of farmland, recognizing in the future that food security is a big problem. Food security, global climate change is all coming home to roost. That's why we have to work together. People in the islands of the Fijis and Vanuatu and all those remote places that are going to be flooded need to work with us to find ways of how to reclaim the land, how to stop soil erosion. If you're living in West Africa, Jess will testify to this, people in Liberia, Sierra Leone are being flooded by simple rains. You know, those of us who survive rainy seasons will tell you that if you don't grow the trees, the rains will come down and it will flood your village. And you'll have torrential rain that will take cars and human lives away. If you live in the Gambia and you buried your aunt now is out to sea because that land has been reclaimed. So, in essence, South-South Technical Cooperation and academia has to work hard together. I myself am working with the University of Bahrain and others in doing more on SDGs and technical cooperation. I think more people like Jess and the University of Dallas have to take the lead and have to overcome national policies and national fears of building a greater, better society. I hope you will enjoy it. By the way, this is a road from South Sudan. It just shows you the realities, and Jess will testify that this is a good road and it's dry. In the rain, it's a swamp. Enjoy.
I know how busy your schedule is. And a lot of what you brought up is very interesting. We've had a couple speakers, including, the lead speaker, really talk about South-South partnerships and really needing to transition more and more into building pilot efforts and policy efforts and financial efforts that really do build on the South-South learning. But one of the highlights that has come out of our speakers from Kenya and from Benin is really the problem that so many, especially academics and evaluation experts in the Global South, often don't get brought on, don't get the same opportunities to inform policy and programming, and also aren't recognized for the efforts they actually do. And you can see that in international conferences where, when you look down the program or the presenter list, representatives from the Global South will maybe make up 1/5 of the total people presenting, even at virtual conferences. I was hoping maybe you could speak a little bit about that.
That comes down to the member states themselves. That comes down to the donors themselves. The UN is a government agency. We cannot do anything without government approval. Now, from OCDAC conferences held in the Paris agenda to the Busan agenda, there's a lot of talk from governments themselves to donors themselves of promoting South-South technical cooperation. It has to start at that level. There has to be a mandate that says, for every conference you do, you need to have a certain percentage that's representative of the South. Now, there's also, those of us in development practitioners call it the White Tower syndrome. Why we call it the White Tower syndrome? Because it's politically correct not to say white man syndrome. If for instance, classic example, if I was an advisor to a government in Africa, or even an advisor to someone of from the subcontinent, if I went to India, Bangladesh, or even Malaysia, or even China, or even to the Middle East in Bahrain, Saudi Arabia, UAE is a great example. I've been working for the last 3-4 years in UAE. Now, the pigmentation of my skin color means I'm already downgraded. I'm already frowned upon. I'm already considered a low-level person. There have been many examples where because of the color of my skin and the look of my, well, there were the days when I said I was youthful looking, but I don't think that quite applies anymore with this grey beard. But those are the days when people of a government minister would look upon you and say, but who is this guy? He's too young. He's not the right color to be an advisor. No, that's changing. There have been many times when I've been in a meeting in Nigeria of government ministers, and they'll be saying, oh, this is a UN advisor. And I speak to the people in the room. These are PhD, Oxbridge, Cambridge, Harvard, Nigerians sitting in the room as government advisors. And I'm looking at them and they're looking at me like, but he's the one with a PhD from Harvard. I'm from Manchester, Leicester University. That's the guy with a PhD. But you're the one who's paying him. So the incentives have to come from the member states. They need to recognize. They need to stipulate to donors. Now, let's not beat around the bush. Let's be honest. Donors use the development game or play the development game. USAID is a classic example of the development game. USAID stipulate their funds can be only used for American academics and American universities or American companies. Now, CEDA, the European donors don't say that, but they don't hide it. You know, and look, let's be honest. Also, the one who pays the dollar is the one who tells you where the dollar should be spent. Now, you can go the route of the Chinese. The Chinese say, do what you want, but we're coming to build the hospitals, we're coming to build the roads, and we're going to take you on a holiday to China. So, you know, let's not beat around the bush. The donors play the games, the member states play the games. The member states themselves need to break the. It's also a reality of the public. The public need to ask and demand for greater representation. It is a balancing act. Jess, who's worked a long time in Liberia, will tell you that often some of the greatest enemies of the South recognition is sometimes the astro that comes back. You know, they come with a chip on their shoulder. Oh, I'm the one from Harvard. You know, why are you? It has to be a balancing act. There has to be, I think a good example has been the Tocton, UN Tocton program. Liberia and Sierra Leone, after years of civil war, had a huge gap in the civil service. Huge gap. So the UN came up with an idea where they would bring people back, Liberians who were in America, back to live and work in Liberia for the ministries, for the government. But their pay would be supplemented with additional funds from the UN. Singapore is probably the best example of a working civil service that is not easily bribed because they have the money to pay the salaries. How does the government do that? The government needs to stop the corruption. It needs to stop the flight. It needs to have a good taxation system. That's a whole different topic another day. But people need to recognize you pay your taxes, then you can fund good government positions. Lee Kuan Yew, the Prime Minister of Singapore, was paid theoretically, what we always heard was $1 million. There was no way you could bribe him. But you know, later on you learned he wasn't bribable. But at the end of the day, it's the donors play the games, the governments need to play and be more assertive. No, we want to have at least a national, and you'll see that more and more now in terms of international recruitment, that you need to have a national with you when you do an international consulting. When I did the SDG report for Sierra Leone, the MDG report Sierra Leone, I needed to have a national with me, accompany me, so he will be able to learn and do the stuff that I was doing. So there is that world recognition of how to bridge a gap, but it has to happen. It has to happen at the donor level. It has to happen at the member state level. It has to happen at the general public level. But the problem with the general public is the general public has been tainted by bribery. They always feel that if it's a Congolese doing the work in Congo, the person is laying the foundations for corruption. If it's someone from the outside, there's a feeling that the person is corrupt. But ironically, they're both as bad as corrupt as each other. So in essence, to answer the question, the donors and the development practitioners have to stop playing the games. And I think what COVID has done is, in some ways, has gone in a way to break the mold. There's now a growing recognition that the need for greater national recruitment. But also, the reality is national recruitment means there's a level of laziness that kicks in, which is, it's unspoken word. An international person on an international project works more diligently, as much as I hate to say it, diligently, more harder to get the results over the line. A national person, there's a level of corruption somewhere in between there. There's a level of, well, I'm here for the rest of my life. Why should I rush to get it done? I need this as a job for life. Whereas if you're an international person who's been sent to a hardship post, your ambitions are get in and get out. Those sometimes are the hard realities of what's going on. The success of Chinese people in Africa, as bad as it is and good as it is, the roads are working, the hospitals are built, universities are built. Whether they're fantastically built or not built, they're built.
Definitely. No, I thank you for your insights into this, and it's very thrilling to see the different speakers and how you're each bringing something new, but really there's emerging trends that we're starting to see. So I really appreciate you taking time with us today, and
Sure.
Yeah, thank you.
Not at all. Hopefully we'll see each other somewhere without the video.
Recording stopped.
There we go.
This one too. I've got another one. I do 2 recordings.
So thank you very much, Jesse, and thank you very much for all our viewers and those are participating to this event. My name is Joe Matangwa. I'm medical doctor by background, originally from Republic Democratic of Congo. Live in Canada the past 10 years. I've been working in international development in both sector, humanitarian and international development. I accumulate over 15 years of experience. I've been working in country like DRC, my home country. I was in Kenya, in Guinea-Bissau, in Central Republic, in Haiti. I was also in Liberia. I work in Sudan. I work in Tanzania, in Kenya, as I said. I work in Lesotho. I work in couple country, again, Uganda, as I mentioned. So it's a project for me, carrying all those humanitarian and international background. I want to share with you my view on what today we are calling about decolonizing international health, and then I will focus on global health. So as I said, currently I'm working with my colleague around this company that we create. I'm the co-founder of African Sustainable Development Advisor, and I'm a CEO. So African Sustainable Development Advisor is a firm that I will be explaining to you a little bit. So for the purpose of this presentation, I will go through a little bit of history about colonial presence in Africa that you guys are aware. And then I will give you some thoughts around international AIDS, what I call a modern day international plantation. So that's maybe a little bit hard for others to swallow, but it's good from my perspective to share with you. We'll talk a little bit about colonial heritage influence in international aid. And then I will give you some word about decolonizing global health and African voice. So that will be really the case of African Sustainable Development Advisor. And as we say, who knows African better than us? I need also, get you a little bit of sense on international aid and policy to improve African voice on decolonizing. And as you know, we are talking here around COVID time, so the power balance and COVID-19. And then we'll take some time on Q&A with Jesse and Camila. that's not new for all of you. You know that colonial presence in Africa that started in the Congress in Berlin in 1884, where 15 European countries, so those are power dividing Africa between them. So by 1914, those imperial power had fully colonized the continent, exploiting people and resources. As you know, when they sit in this Congress in Berlin, they didn't ask, African people or African citizens, what is your point of view? How do you feel in us dividing Africa? That's everything starting from there. You can see people from Ivory Coast, they have parents in Ghana. People from Ghana have parents in Mali. People from Mali, because some tribes in Ghana, they are the same tribes in Ivory Coast. So they divided Africa without asking Africans their point of view. So that's where all those stuff, all those concern from colonial point of view started. So people couldn't stay the way they are. They took time also to review a little bit of how, when the power started, the power balance started. So there was a chronological list of African independence. So the draft I'm showing here, the map, it's actually how those colonial people started leaving Africa. They couldn't leave Africa for nothing because there was a starting point, right? So the Second World War was the catalyst for African political freedom and independence. So as Europe was feeling like weak, they brought African to fight in the mid, and then the Second World War II led the decolonizing of Africa by European, both African and European military, psychologically and politically, economic was impacted. We have here, those countries have been colonized, and then part of them also in Africa, for instance, Liberia, never been colonized, but it was linked with the US company. And also a country like Ethiopia, never been colonized, as we can say. But most of African country, as from 1994 up to 1980, so most of African country, the wave of independence came around 1950, and you can see most of country was around 1960. Yeah, so as you know, for me, international aid, it's a kind of a continuity in change, because the power, the colonial power, they couldn't left Africa without having, without having the harm and having control in Africa. So a lot of things have moved forward, but at a time of independences, those imperial power, they thought that they need to remain in Africa and still keeping the influence in Africa. So what we saw, there is a lot of concept have came around, kind of cooperation policies. They bring cooperation, and then they bring international aid, they bring international development, and now they're talking about win-win partnerships. So all those concept is actually for European imperial to do not leave Africa. So they want to still keeping Africa, they still keep Africa under their control. That's why around 1940, that's where international aid started. So the idea behind this was, right, sending Europeans, going to Africa to save life, because the human resources was not well-trained, well-equipped, so infrastructure was not at the top. So for me, knowing that this international aid, it's really keeping people in Africa under control, because they need anytime turn around and come back to the colonial power where they are receiving aid. I want to talk a little bit about the colonial heritage influence. So Jesse and I, we work in Liberia during the Western Africa Ebola outbreak. So this graph is showing us a little bit how those countries, the colonial heritage influenced the response in West Africa. So we know, for instance, Guinea-Conakry has been colonized by France. So the presence of France, and France AIDS was actually in Guinea better than Liberia. And in Liberia has never been colonized, but they have a link in US. The US founded Liberia program was better than what was US presence in Guinea or in Sierra Leone. And knowing that Sierra Leone has been colonized by UK, by the British, the presence of the British in Sierra Leone was also better than British presence in Guinea or in Liberia. So what does it mean exactly? What we saw during the Ebola crisis in West Africa, the presence of US military, US funded project was huge in terms of money than what US invest in Guinea, Conakry, or in Sierra Leone. So the country still have affiliate to the colonial ways. That's really what influenced the colonial heritage. We can see that in a lot of countries. So talk about DRC, where they have an issue. The first point for them to run is in Belgium, right? So those colonial heritage is still influencing international development aid, being humanitarian, being in development. So the influence of colonial is still in Africa. And you can see here, for instance, the data we receive broadly. France founded around 110 million in Guinea, but over 20 million only that was shared between Mali, Cote d'Ivoire, and Liberia and Cameroon. So the UK committed around 400 to 27 million pounds for West Africa. But if you go deeper, you'll see this money went a lot in Sierra Leone, where they are their presence and interest. Yeah, so how do we decolonize global health and build broader equity? So I know it's not a new word. So, but actually, the past 2 years since George Floyd, death in US, a lot of South voice have been bringing it up in terms of decolonizing. So it's really a high-level conversation, and everyone outside there have been talking about decolonizing, because we saw that there is a power balance, and then we're still seeing that there is colonial influence in everything that international aids are being taken around. So how is African, how is Black people, or how the low-income country can really decolonize themselves from the power of colonial, or the power of the influence of power of colonial? So I know there is a lot of idea that you guys and others can discuss, and we can bring it in the table as international development professional. But here I'm just thinking a little bit of 4 of this segment. First of all, for me, I think we, Africa or international aid, we need to reforming the education and the research system that's centered on the real needs. So if you see, for instance, most of African countries, the education system has been copied from the colonial way, right? Maybe that is not actually the way Africa needed. And then in terms of education also, in January, you saw the first Black faculty representation. So I'm a medical doctor by background. Since I was in school, I never see a Black faculty, because all books and all manual has been written by white or Black people, but the representation have only white people, So actually we need to review our education system, and then the research that African scientists are taking out, because as long as we don't have the same needs, I always tell my people back in country, for instance, the Canadian education system, it doesn't make sense in DRC, because when my kid was when they was in kindergarten or in the daycare, that they are talking about integration. Actually, they are telling them how to be independent, or removing the shoes, removing the coat, and be present. That doesn't match in the same system in the DRC, for instance. So African leaders, African politics, we need to think about reforming our education system and the research. We have also to reimagine technical assistance. That's I like it. Why? Because we see when COVID started, for instance, I was working in Kenya, but since COVID started, I couldn't go back in Kenya because all those, travel restriction. But how do we know now the project's been ongoing in Kenya? We have people from the Western, expats or not, sitting in their home country, but project is being implemented in Africa. They couldn't travel. But at the time, is there capacity building? Was there a transfer for those, beloved African could run the project? So we need to rethink about the technical assistance, empower people, transfer. So we can't talk about decolonizing if we don't transfer capacity, transfer technology, and then empower people to, take care of themselves and promote what they are doing. The third one for me, it's really promoting Africa fundraising initiative and startup. We do have, mining company, a lot of companies in Africa. So anytime we are turning in Western, seeking projects, writing projects, begging for money in Western system, nothing will change, right? We will be in the same circle. So, but African initiative of fundraising in Africa, there is a lot of bank, people have money, they can really invest in Africa and promote any African startup. So that's where we will be a little bit dependent on how we are doing our programming and how we really need to get our, intellectual freedom in the global health also. So the last but not the least, it's African experts have to tell their own story. As I'm doing now, as other fellow African will be talking in different topics. So we have to tell people that Africa is not only what you are seeing in TV, how they are presenting you Africa in the media, in Western media about crisis, no, that's not Africa. Africa has people like me, like you, people have been talking here, right? We do know exactly what is Africa and we know what our needs are. So let's African experts start telling their own story, their own success. We have to write, to publish any success story that we Africans are doing. Yeah, so that's why actually I'm telling you about how we need really to decolonize global health. And whereas African voice, African have to stand up and then talk about Africa. We need to really to influence by talking and then calling a lot of people to do the same as we are doing. As you know, in the last year or two, there have been growing calls for decolonizing global health. That's a good thing. If we are talking, you are giving us such platform to talk about that. That's actually what we have to do. So those calls recognize the fundamental need of global health institution and practitioners to disseminate the parental structure inequity perpetuated by global health colonial heritage. As I said, hospital, public health system have been copy-paste as 20 years or 19 or 100 years of colonial heritage. But things have been moved. The same global health is not the same here in Canada or in Africa or in the US. So we need really to take it out from the colonial heritage. However, those calls for decolonization have largely been led by global health practitioners based in institutions in global north. I'm here working in Canada, and we have a lot of people in the global north where we need really to stand up and then talk about the voice of Africa. At first value, it's apparent that the global health institution and practitioners in the global south have not been visible or vocal madness the call for decolonization. So as I said, I'm super happy that this conversation will go further and then other people will be aware of really what we are talking about decolonizing and how the bad impact of still keeping under the colonial heritage can really impact our life of society. Yeah, this is my voice. Who knows African better than us? Nobody, you cannot Google and get where is Kenya, where is Sudan, where is Mozambique is located. No, nobody knows Africa better than us. When I'm going in Sudan, I know how to integrate the community. I know how to talk to people. When I'm doing risk assessment to invest in Africa, I know how level of risk I will take. You can talk to me that DRC is a corrupt country or Nigeria is a corrupt country. I don't care about it. What I care is about my people, how they are there and how the risk I can take to bring my money back in Africa and invest. I know about human resources. I know about people culture, right? So actually, nobody knows African better than us African. That's why we stand for African Sustainable Development Advisor. So this company, this firm, or this network, we built it from a deep context analysis. We've been here sitting in Canada, going in US, traveling worldwide. Actually, there is a lot of discussion or criticism going on outside there from the Western view. The Western, they will tell you that there is always an issue in capacity building in Africa. However, there are few challenges that's been observed. Anytime there is a Western criticism going on, they will tell you the donors are not still certified with the return of investment, right? So they will tell you that in Africa, there is a lack of trust and confidence and ability to national and local partner to really carry out the project and guideline. Donors are often questioning the leadership of African management. They will tell you that corruption is in Africa, and say, they will tell you there is not lack of a political will and ownership. All those criticisms, we've been hearing that. And then we've been hearing that a lot when you are sitting with donors, you are sitting with Western folks, and they will tell you the truth, right? Dr. Joe, we respect you, but in Africa, there is a lack of political will. They will tell you right away. Yeah, that's good to hear. But when I'm going in Africa as well, I'm hearing where my people are talking. They were complaining also, complaining about what is going on in Western. What we know, what we learned from our context analysis, that there is lack of integration and regional priorities. Most of the time, the donor, when they are bringing money in Africa, they don't consider the culture. They just bring money, and then they don't consider the priority of country. We don't want to do business as was 20 years ago, come build a washroom or whatever, or dig bowl and go. No, we need really to get harmonized the policy, different between policy of donors and national policy. Lack of involvement, when they are coming, Western are bringing money, most of the time we see that, and people have still complaining. I was in Uganda presenting in one conference around comprehensive sexual education. And someone told me, yeah, we need it. It's okay for us, but at least we want it to be sex-oriented, right? So most of the time, there is a complaint. The terminology sometimes doesn't match with actually what the Western are pushing in Africa. Let's talk about gender, equity, inclusion. You guys know better all those aspects of things when Western are pushing around, but African is pushing back because they don't consider each other a priority. So our firm, our network, we really focus on innovation. We can't bring things in Africa as it was in 20 years ago. We really collaborate with African and going in partnership. And the most of thing for us is knowledge transfer and then stakeholder ownership. We want our fellow organization in Africa to take the ownership, and we partner with them, we transfer our knowledge. That's the way we are doing our work. Our services is we are a consultancy firm. We do monitoring, evaluation, program management, financing resources, mobilization, COVID-19 resilience, and most of things actually is a skill and knowledge transfer. We focus on those areas. That's sustainability development goal. We want to really empower African child protection, environmental climate change, gender, global health, and then also social enterprise and sustainability. We really, in our program, empowered youth and women in Africa. Yeah, so COVID vaccine and rich countries. You guys know what is happening right now. So the world without COVID vaccine will not be possible until everyone has equal access in the vaccine. Yeah, let's talk about you guys in the US. You've been having your booster. Here in Canada, we've been having a booster. My fellow in South Sudan, maybe they never had even the first dose of COVID vaccine. So while we are going for booster, and we still have people who doesn't have at least the first shot. So as long as we have this inequality, no one will be safe in this globe, in this world. So actually, this inequality of vaccine distribution is not only leaving millions or billions of people vulnerable, but deadly variants. It's only allowing even more deadly variant to be emerged and spread across the globe. So it's a headline, as you know, vaccine is not for the rich, and African has really to move forward to bring discussion. The good thing is there is a lot of investment in Africa where Africa will be manufacturing their own vaccine. And that's the way we need to be independent, intellectually independent on what we are doing. So I get this graph from KFF. You can see the graph that a lot of country, the rich country, they cover 54% of a vaccine, actually, the high country, the high income country. And then the lower country is around 3%. That's actually so sad. And the vaccine is for everyone, even we are moving for decolonizing everything. So that's a little bit of my presentation. So I will leave to you guys for a few questions so we can have a sense of what I'm doing. Thank you very much.
Thank you again so much for this amazing presentation. You know, I had the privilege of getting to work alongside you during Ebola. You know, you and me shared a lot of some of the issues that existed. And one of the things, you know, I would love to get to hear more about, and I have a lot of my students ask about, especially the ones that want to go into international development, is what are forms of discrimination or inequalities that exist with international development agencies?
Yeah, so thank you very much, Jesse, for this. Discrimination and or inequality really exists within international development agency. So, but things have been improved a little bit, but we still seeing those discrimination in terms of human resources, for instance. So some Western agency have been in country for the decade, right? But the senior management position, they still keep it, right? And the directory have been for the Western and local event capacity of that. So I remember there was an intense early position of country director was open in one country where I was working. And then the position was given to a Western, but the national staff who been there for a long time, who knows the politics, who knows the country, who knows the law, who knows, you know, the stakeholder applied also. But the thing is, he was the one who was doing kind of acting where the CD was not in place. But at the end of the day, they say you are not qualified for the position. So the discrimination has been around recruitment, even though things have been improved. I know such international organization now where the CD or the the COE they are from Africa, Black African or African descent. But the inequality in terms of human resources, inequality in terms of salaries. I can give an example as well. Working as a national staff in DRC 15 years ago, my salary was not even what the expat nurse was receiving, because she's from UK, she was from US, right? So she has allowance, she has per diem, she has risk, whatever. So those disparity and discrimination and inequality still exist right now. But things have been improved, but still you can find that in the field of international development.
Thank you. No, that's a very large problem, again, to address, is that discrimination, especially at management level and within human resourcing. Wonderful. Thank you. And then two, how would you define, if possible, what is colonial behavior today, cultural sensitivity, dependency, trust, and, you know, um, you know, just what advice are we missing with for Western organizations?
Yeah, thank you very much, Jesse. So colonial behavior, we're still seeing that in Africa, in colleagues who are coming as expatriate. I was a national staff and have grown from national staff in DRC. And then I had a chance to be an expatriate in all those countries. I said I was in Haiti, in Kenya, in Sudan, in Central African Republic, in some Liberia. So I, as an expatriate, right there, I got another status. But colonial behavior are based on my experience and experience from other colleagues. We can say there is still colonial attitude, far Western agency organized, working with local agency. There is all, this power of coming to save your life, even though you don't know what's actually the culture sensitivity in the country. I know, for instance, I've been in Sudan, working in Sudan. It's a Muslim country. People behave the way they are. So we see that most of people are coming and fail. They don't really meet the expectation of traveling in countries. They do not even know the culture. They know, right? You can go in Google, you can get brief from your HQ, but culture sensitive, it's a lot that we can see how to respect people, how to deal with local community, how to respect their culture, their religions, their behavior, their food, how they the dress code. So we still think a lot of those culture sensitivity that Western are not meeting the same expectation as African countries, but there's still an issue. I'm saying it's been a past, but the thing has been improved, but we still have it like in the blood, and people are kind of that. So in terms of dependency, another hand, one of the case sensitive of attitude of dependency from local agency, they see white people. Okay, they call you a boss. It depends of country. I know in TRC, they will call you Mundele, in Kenya, Muzungu. It's actually kind of a stereotype, but this stereotype comes with a power of colonial, right? Power shift, actually, power balance. They call you Muzungu because you behave as a Western. I remember I've been in Canada. One day I was in Kenya eating in the restaurant, and the restaurant with folks, and then I'm a black, and the waiter told me, oh, go and serve this Muzungu. And then I turned around and say, I'm not a Muzungu, I'm a black, I'm from Congo, actually. So why you calling me Muzungu? Just the way I behave in the public way, in the restaurant, they thought I'm not a Kenyan. Right, so those dependency also we saw in Western, they are coming monitoring visits, talking about instance agency and discussing about equal food. You have to always watch what you say, right? So the way we say, the way we behave may not be the same that Western are behaving. Other thing also is a trust. For me, trust and accountability is where we have to build. So all those agency, Western agency, most of the time, they are trying to build trust, but they have a backup of watching over what you are doing. When you travel in country, you go for briefing in your HQ. The briefing will not only tell you about the program, they will tell you about people. Hey, you are going in DRC, there is a medical doctor, his name is Joe, watch out, be monitoring him, that's the way he behaves. So I've seen that as well. So coming in the country, instead of doing your job, being performant on what you are doing, you'll be watching after Dr. Joe, seeing if what they told you in Geneva or in Washington is the same that you'll be seeing. That's trust actually is a big issue. And then also for Western agency, we really look how much down at local agency. For them, local agency always lack capacity through not all local agency do, right? So way back was we are saving life. But as I said, Africa now have a lot of expert, a lot of experience. I was in Central African Republic. I can say around 50% of expatriate was for DRC. In 2010, after the earthquake in Haiti, I can just name, Oxfam or Marlin, the NGO was working. They took the staff from DRC and they went in Haiti, right? So African has been having a lot of international people are working now. We came from local NGOs, but most of us didn't have the chance as I did, right? Growing from local NGOs and coming expatriate, and today running a company where we are moving on a network. Yeah, so there is a lot for Western agency to look local NGOs as a partner, not only as a power balance or power shift.
That's very powerful. I mean, especially as a Mzungu, and I always am very proud of that. I'm Kwipuma. I know I'm a Kwipuma. No matter how long I've lived in Africa and Liberia or in Latin America, I will always be, a very, very blonde American. And it's one thing I love learning about this because it helps me know the issues you're dealing with and how can I help, like how can I be of assistance, and knowing that maybe some of my staff is not is holding back what they want to say because they're worried I'm the boss and they'll get in trouble, or they're worried I'm judging them and they could lose their job, or saying that I trust them, but here am I actually authentically trusting them, or am I monitoring them? And then you say you're doing this work on the ground every single day, the conditions, the face of how to get this work done, and the fact that so few experts from these regions get to go upward into high level positions where their knowledge and their expertise could really be of much better use at a higher level. Thank you for that. And then based on that, what really is kind of your experience about, African voices being heard in international development?
Yeah, so indeed, African voice should be heard on the Western, should not be reactive in the idea. So our Western agency, most of the time, they should listen to the voice of local and not change things to be in the government policies. I just gave you an example of sexual comprehensive education. Just the way the word comprehensive and age appropriate create a 48 hours debate in one meeting I was in Uganda. Another thing also, let's talk about gender equity, whatever, inclusions. I'm here in Canada. I can do, actually, my wife and I, we share tasks. That's okay for me. But going in DRC, things may improve. What people will say. So people are pushing for stuff that can be sensitive in other country instead of stop demonizing people and try to understand where people are coming from, discuss their need to find a common ground. There is a lot of things I'll sit down, and the bottom-up approach seem to take time, but they have been obtained by some international agency. International NGOs West are seen as a branch of the government. When you work for NGOs and coming in Liberia, people will see you that you are an American. And as you say, they thought that you are bringing a kind of surveillance, monitoring people, instead of collaborate and trust. So for me, when it's said that the best law policy takes precedent, it's hard to be applied, not done often because one of those local countries are always being as not practical. So we really need to make African voice, because you can't do anything in Africa without African. I've been always telling my friends, my colleagues, that we advocate here in Canada, in the US, let's advocate for instance, for abortion. Let's talk about it if you want. Or let's advocate for family planning. Let's advocate for gender equity or whatever, or gender inclusion. You get money from USAID, you get money from Global for Canada or any donors. And going in Sudan, going in Malawi, going in Central African Republic, or going in Liberia or whatever, the country say, no, we don't want those laws here. What are you gonna do? Are you gonna come back with the money and give money to the donors? No. So what I'm thinking here, it's actually starts from going in Africa, discussing with people, what do you need exactly? And then we can create a program where we all are feeling safe, and then we all are promoting equity for everyone. So not kind of dictating, because that will not work. And in Africa side, also African leaders have to stand up and talk about Africa, and then also have a strong position that can really thirst what Western are thinking, and then we can have kind of a good partnership. Yeah.
No, that's wonderful. And just for context for some of our viewers who maybe don't understand INGO versus NGO, an INGO is the international center, the headquarters often based in London or in Washington, D.C. or San Francisco. And, they are the large ones like, like Save the Children, Child Fund, Plan, there's so many. And they have little branches that are regional offices, and then they have the national office, which is the NGO level. And so I really appreciate hearing, how the NGO, the national level should have a bottom-up approach to really inform into, these grants, these projects, these policies for more sustainability, and also
Correct.
Not to be patriarchal, it is. Yeah. What are some good practices and bad practices you think we're facing as international colleagues?
Yeah, there is some good practices so far, as I said. So, for instance, today we do have NGOs and international NGOs or movement or federation where we have Black people as CEO, where we have female as CEO. So the first good practices for me, it's provision of external skill and knowledge. Those are good practices. I know we are different contexts, difference of a view, but actually when we are doing on knowledge transfer, that's a good practices for me. And the second one is the financial support. We know a lot of countries in Africa, they have a good plan. They know how to write, and then they have a strong policy. They have a strong guideline in any sector of we are doing. But financial support can be an issue. So where we are having, practices, writing proposal, discussing the budget with colleagues from Western, that's really the financial support to contribute for making difference in poverty alleviation. But we still have bad practices, as I can say. I don't want to say bad practices, but better kind of challenges, because I know things has to be improved and everyone is working hardly on that. So the common unfair human resources practices internally, as I said. So as I told you, I had a chance to work as a national staff and then move as an expatriate, right? So my salary was, I was a national staff. The first time I left Congo and going in I left DRC and going to Haiti. When I signed my contract, and my salary was in pound, right? So I was shocked. How much? Oh my God! I was so excited. But when I start brainstorming and seeing my fellow Asian salary, I get shocked. That was the same feeling I felt when I was in DRC. So human resources is still a big issue. That's Western has to promote, that we have to promote, having people locally, and then they are there. I know them in our network. We do have professionals sitting outside there in Africa. And then other challenges, a bottom-up approach on one size fits all approaches that many intends far away from reality. So go talk to people, discuss with them, get their view, let them do the assessment with you. They will tell you the need, right? Don't think that because they are in Africa, they need washroom. No, they need running water. Maybe they have running water. What they need is food. What they need is education. So hear them. Instead of sitting in UK, in San Francisco, in Toronto, writing a good proposal, getting money and going back to Africa. No. Please get your time to do in-country assessment and discuss with your partners, then you can find a way to improve. Other thing also challenges resilience from some agency to have employees and they are, penalized with local level. it's accepted. So that's a big challenges. Challenges also, it's on action synergy on common goal, and organization sees as a profitable business. So those are challenges that I'm saying, if we can improve it, the world will be better, and they will have a balance between international law, international development, and then local agency to improve the policy that we want to make sure and everyone can be safe. Yeah.
Well, thank you again so much. And, are there any concluding statements that you would like to, just kind of add on before we sign off? And again, I just can't, as someone who's worked in nonprofit for 20 years, you're definitely one of your name. And it's been an honor getting to learn from you and to get to hear your perspective. So thank you. But I'd like to let you end this presentation.
Yes, so thank you very much, Jessie. As you say, you and I, we are former colleagues, and then we've been interacting for the past 5 years. So today, I think the present distribution of international aid to the low-income countries is just another form of modern day international plantation. I'm sorry to say that. So as long as you can agree or disagree, but until people are not given equal access in voices and opportunity to control their own environmental, international aid will always be colonized. So we really need to get out of this system and then follow what Africans are saying, improve education, talk about success story in Africa, and let's work in good political system where we can get funds from Africa and improve also, the work that we've been doing so far. So thank you very much for, people have been attending this event, and then thank you very much for you, Jesse, and all your team and your colleagues to bring folks together to discuss about, international development aids and how we need to decolonize global health and international health. Thank you very much. I appreciate it.
Our last speaker of the day is Hanifa Nakiora. After surviving an acid attack, Hanifa Nakiora chose to reclaim her identity by unveiling her scars. In doing so, she unveils awareness about this growing form of violence and shares hope and empowerment for victims. Hanifa Nakiora is the Global Health Associate at the Jewish Healthcare Foundation, working to advance the goals of JHF's Women's Health Activist Movement by applying her internationally recognized leadership and advocacy skills. Prior to joining JHF, Hanifa served as a special projects intern for the Pittsburgh Foundation during her final year as a graduate student at the University of Pittsburgh. She is a recent H.J. Heinz Fellow and a second career graduate with a Master of International Development and Human Security Studies from the University of Pittsburgh's Graduate School of Public and International Affairs. Prior to attending GSPIA, Hanifa completed a master's degree in economics at the University of Nairobi and a Global Change Leader Certificate from Akodi International Institute in Canada. Thank you again for joining us at UT Dallas. In partnership with the Office of Research and Innovation, the School of Economic, Political, and Policy Sciences, the International Center, as well as the University of Pittsburgh African Studies Department and the Harvard Alumni for Education's Sub-Saharan Africa chapter. We would like to provide a special thank you to Provost Inga Musselman, Dean Juan Gonzalez, and Dean Jennifer Holmes for their support of this conference.
Okay, we're recording.
Sure. My name is Hanifa Nakiora and I'm from Uganda, but I'm currently living here in Pittsburgh, Pennsylvania, we have been living for the past 6 years. I came here as a graduate student in the International Development Program at the University of Pittsburgh, Graduate School of Public and International Affairs. My current position right here in Pittsburgh is Program Associate at the Jewish Healthcare Foundation, where I mainly focus on maternal health policy research and advocacy. My background coming from Uganda is in human rights advocacy, and that's what led me to come to the University of Pittsburgh to pursue the master's program in international development with a specific focus on human security studies. The inspiration behind that was the lived experience in my field observation of how international development programs run in my country of Uganda, especially when it comes to community-based organizations and how they are involved in international development programming. Of course, when we talk broadly about international development, that's a Western term. It's a Western terminology introduced to the South. And so usually that comes with ideas developed by the people from the Western world, programs designed for the people in the South, and implementation strategies that are actually sought after by consultants in the Western world and brought down to the South, where we are expected to implement, to follow the protocol as it is being outlined to us. And usually, I remember when we were still following to meet the Millennium Development Goals, that's how it was. The money grants came from the West and they were injected into our countries, our communities, but that money came with expatriates that were going to help us to understand how those programs run. So what really stuck with me when I started my career in international development, I started it as a program monitoring and evaluation specialist with a UNICEF program in my country, and looking at how programs are implemented and how they are introduced and the expectations and results and how results are measured. You realize that the international development agencies come into the community and they are looking at collaborating with either government agencies and large nonprofit organizations that already have the structure and a well-established profile, so to say. But we are talking about community development, grassroots development. The beneficiaries are the people at the grassroots level. And usually these programs, as they are designed, they are assumed to be designed for people who have the least access to resources, basic human resources, but the people actually who have the least access to the basic resources in life are the ones actually who are incapable of having a structure in place as far as guidelines and eligibility criteria is concerned. I'll give an example. One day when I was doing my internship here in Pittsburgh, I was working in a scholarships department and looking at the eligibility criteria. They are looking at people who are coming from underserved communities, under-resourced communities that would otherwise have no access to the education. And I talked to the director of the scholarships program in that department, and I asked her if she's aware that the people who come from Africa, that they classify as under-resourced are actually the ones that have the access to the resources, so they get access to the information and they are able to apply for these scholarships and come. The true underserved or under-resourced students don't get the opportunity because, first of all, they don't have access to technology. They don't know where that information is, and as a result, they are getting the best of the best in our countries, of the wealthiest, and they are the ones coming here as the under-resourced. So that was an example I gave. So when you look at the eligibility criteria for most of the international development programs, they are looking at partnering with non-government organizations in the host countries that are well established, have a structure in place, have staff in place, have infrastructure in place. And those are actually the organizations that are doing well. And they are in the position to play the game with the international agencies that are funding these programs. The beneficiaries who are at the grassroots are the ones actually who don't have all those qualifying factors that give them access to that kind of funding that enables them to carry on community development programs to meet the basic needs that they need. So the large organizations in the host countries eventually eliminate or leave out exactly the group that should be benefiting from these kinds of programs. And they end up implementing programs to meet the expectations of the donor country, right? And as a result, I, the beneficiary at the ground, will never know what goes on. But somebody is reporting that they are serving me. And that really disturbed me so much for the time that I worked with the big agencies and observing that in the community. I'll give an example of if you're talking about capacity building or empowerment, and the empowerment you're talking about for a person who doesn't even have high school diploma, GED, or even I will talk in lay terms in my country, who is not even a graduate of primary 7. And that's the person you're talking about empowering. And in your programming, you're talking about holding training workshops to come and train the people, for instance, financial literacy. And you're bringing in experts from the West who are going to carry out these programs and are going to evaluate whatever happened. And the big NGOs know how to do that. When you look at the budgets, I would look at the budgets as the program monitoring and evaluation specialist, and I'm looking at the budgets, and you find someone is expected to travel and come to the city in a 5-star hotel. That's where workshops happen. In a 5-star hotel, they are paid transportation to come to a 5-star hotel, but they are coming from a place where even their child is not able to go to school. So in my mind, as a community-driven person, I am wondering if I could translate that money, the 3-day workshop per diem and accommodation and the fancy meals, and give it to this person that I'm bringing from the community to go and change his household lifestyle. What an impact it would have. In my mind, I am thinking about one individual, but the agency that is funding this program is thinking in terms of numbers. And if you don't have the numbers, then you have not influenced change, right? But to me, it's not about the numbers. I always say in my TED Talk, I talk about every statistic beginning with the number 1. And so in my work, as a way of trying to be inclusive and raising voices for those that are always left out or they underrepresented in most of the international development programming, I emphasize the qualitative impact of a program versus quantitative impact. If I'm improving quality of life, that is what should matter. If I want to improve quality of life as an international development expert, I need to understand, first of all, what the community really wants that I want to influence, other than looking at the community, run a baseline survey and decide, oh, this is what this community wants, and this is how we are going to deliver. In fact, I may say that at the end of the Millennium Development Goals, we had not achieved them. That's why today we are talking about sustainable development goals with the common theme, nothing about us without us. But again, there are so many voices that are still left out. The components that made the Millennium Development Goals fail to meet the expected results. We are transferred, they were transferred over into the Sustainable Development Goals. And we still see those small components. Why don't we invest in grassroots so that because the people at the grassroots level are dealing with the beneficiaries every day and they understand what the challenge is? Why don't we pull out the least represented at the decision-making tables? In the West now, we are talking about diversity, equity, and inclusion. If we can really embrace that and bring those voices to the table, empower those voiceless to be brought to the table and empower them to bring their ideas, the people who are least listened to, whose voices are not really represented, are the ones who have the most powerful ideas that would influence change. And that's what I advocate for every day. Let's include those voices that are underrepresented. We need to get their perspective in terms of programming and how we are going to evaluate programs and how we fund, how funding is channeled and how it is allocated, other than expecting to just inject money and tell them what to do, inject money and expect money to yield results that you have set at the high table somewhere in a 5-star hotel. Let's go to the ground and let's live the life that these people live and work together collaboratively and see how we influence change collaboratively. It's collective impact that really needs to work in international development, and also understanding that the problems of one community are not similar to the problems of the other community. So if I'm designing a program for Bangladesh, I need a Bangladeshi to be at the table. And I don't need the Bangladeshi from the ministry. I need a Bangladeshi from the ministry, yes, but I also need the Bangladeshi who is going to benefit from that program. If I'm designing a similar program for Uganda, I'm not going to look at the demographics of Bangladeshi and conclude that Uganda will have similar factors as far as programming is concerned, and so we are going to replicate. No, Uganda's problems are unique and different than Bangladeshi problems. So if we are going to replicate the same programs and distribute funding, we need all those parties at the table and collaboratively work together for us to have a collective impact. And so that's something we really need to focus on and figure out how to do if we want international development to really meet the goal that it was set for by the premier scholars who brought it into place. Probably that's what I can say.
Great, thank you so much. We are going to go ahead and open this up. I and some of the other collaborators got together over the last few days and have received feedback on what people are noticing as common threads in between this. And we are actually hoping to share that and then get feedback from you all about what you've noticed and what you found to be, engaging questions you may have. So let's go ahead and do that. So currently, my name is Dr. Jessie Hansen DeFusco. Again, I teach at EPS at the University of Texas in Dallas, alongside with Dr. Camila Morales. I also want to extend a thank you to Demita from Arizona State University. She presented, she was our first guest speaker. She's also led enormous efforts to help make this conference transition from being in person to virtual. So thank you to everyone. But we got together and we thought about what are the connecting themes. And as a policy professor and someone who's worked 15 years or more in international development, primarily in Africa and Latin America, You know, I've played a lot of different roles, both on the ground and at international development organizations, alongside a lot of the people who spoke over. A lot of these people, including Sakil Malik, I met, you know, when I was just 28, just entering nonprofit, and luckily I really got to teach me a lot. But I always think about this as based on Harry Laswell's policy cycle, defining policy problems. So the first stage is you need to understand what's the problem, right? The second stage then is to find a solution, like how are you going to fix that problem? You know, whether it's in Nairobi or whether it's in the Dominican Republic, you know, how are we going to go forward with helping with that? Then you have the policy and programming planning. So then once you've found your solution, you need to, you know, apply for a grant or find funding or get a coalition together to make sure that that will now be applied. And that leads to implementation. So once, you know, a policy is passed, maybe the World Bank works with Kenya to pass a new policy promoting LGBTQ+ rights. Then it's implemented. A couple projects are funded that create awareness about it. So usually an international nonprofit or a larger scale actor like Save the Children or IRC will get that grant to then go create awareness on the new policy. And then after it's been implemented for maybe a year to 5 years, there's an evaluation about the impact of that. What was the change? And then after the evaluation's done, the next stage, which is often forgotten about, is disseminating the findings of the evaluation. Like what was the change? And we heard a lot of the speakers talking about this. And so let's go ahead and look at some of the common threads that people identified based on, you know, these 12 presentations. The first is that mainly policy problems affecting Africans or affecting Latin Americans typically are defined by foreigners from positions of privilege. Whether you deem them Mzungo or expats, they tend to be Western educated or Western people who really come from a background where maybe they earn more money, maybe they have generational wealth, maybe they're higher educated, but whatever it is, you know, that they come with a different worldview and understanding as someone who actually is living in that country, living that problem. And this leads to a huge misunderstanding about context and culture. And this is something that, you know, came out with Patrick Fali, talked about this with a lot of the Ebola programming, you know, the fact that, you know, sometimes the expats misunderstood what was really the bigger problem. And then sometimes would try to create solutions that weren't really applicable to the setting. For example, expecting Liberian Muslims to come to meetings on Fridays when they had prayer instead, or body burning during Ebola, where, you know, in West Africa, body burning is highly taboo. So really just misunderstanding that. And that also then leads into deriving solutions that often have oversized goals. You know, and Hanifa talked about this. Goodness, so many people talked about it. Dr. Joe Matangwa, really having these illustrious goals that will make the person coming in, helicoptering in with golden solutions look good. And achieve, you know, these broad goals. But really, they're not realistic, and they're not the goals that maybe were needed anyway. And then you have this issue that just kept coming up time and again about global North, Global South or donor recipient models, being really using top heavy and top down approaches. And this was something that Demita definitely saw in some of the, talks she had with some of our African colleagues. And it was really this concept that the global North, the international development organizations, or the bilateral donors like USAID or DFID, or larger scale international agencies like the World Bank or UNESCO, really kind of come in, putting the West in the lead, funding heavily the Western staff more than they fund their Global South partners, and really putting all the management, the power dynamics on, giving it to the Global North or the donor, and the recipient, the Global South, has to just kind of take what's being offered. And this in itself leads to a very large problem with grants and funding conditions, which these were words that, these speakers have never met. Many of them have never worked together, and yet time and again, we were hearing the same exact words being used. Grants and funding conditions being stifling. That was mentioned 3 times in 3 different talks. Constraining was mentioned almost by everyone. And really, these being ill-matched for real needs. So really, there is a need to really consider how, like the Bill and Melinda Gates Foundation, how Malala are starting to promote different ways for the Global South to have more voice and having flexible grants that they then can build on during the planning process. The next one is national partners being given less power and voice. And this is really during both all of the first ex ante approach, before the policy implementation happens, defining the problem, defining the solution, planning how you're going to implement the solution on the ground, and then actually starting to implement it. And really, the national partners are repeatedly sharing with us and giving evidence that they are given less power, less voice, and less bargaining position. They're seen as the doers. And, Dr. Joe Matangwa used the term, international development is just the new plantation. And the idea that, the Africans and the Latin Americans are going to go out and do what they're told to do to make their lives better. But the solution is going to be told to them by Western agents, this white savior mentality. And it really kind of makes your skin cringe a little, that this is what is often happening, whether or not people are woke enough to realize this. And really, are they equal partners and equal decision makers? There are cases of agencies that do an amazing job. Children in Crisis, Child Fund, there are nonprofits and international nonprofits that actually highly value their work based on making national partners the drivers, the managers, making sure that they are the ones that are really, at the top positions, and that, expats really take more of a back seat as a technical support role, but not driving the car of change. So in implementation, this came up from Deconti, this came up from, from Tambu and others, really the issue of weak coalitions, and really, looking at using the language from social justice movements right now, like Black Lives Matters and hashtag Me Too, which have spread from, from the Global North into the Global South and have helped actually reverberate into these movements, their own experiences of neocolonialism and imperialism. Really, we're trying to use this language and adopt some of it to modernize it so that people can understand modern day ethical issues with international development. One of the main ones is weak ally relationships. the idea that you say you're upholding and you're uplifting people of color and people who are affected by poverty and social injustice, but really, are you authentically doing that? Do you have authentic partnerships with the government officials and with the national actors? And time again, we're hearing that's not always the story. There's an over-reliance on foreign experts. I, having been a foreign expert for 15 years, have seen it. And at times I would sit there and go, why am I being put in charge when somebody else should be put in charge, who's from this country, somebody who's just as well educated as me or better educated than me, as Vijay pointed out, who, you know, is from this nation and actually knows what they're talking about 1,000 times better than I do. It doesn't mean that Westerners, Westerners and foreign or Mzungu expatriates can't be a part of, you know, the change. You know, we're not going as far to the left as saying no white saviors. The problem is just maybe checking how much we're really going to be able to help and asking them how we can best help. And again, taking more of a supportive backseat role by offering money, by offering, you know, to be a sounding board, by offering to be on a board of directors, but again, allowing them the positions to take on leadership. And Dibu Obondo points this out, that Kenya, you know, it serves as a great model. Much of East Africa has been receiving international foreign assistance for decades. And now Kenya actually has a plethora of experts who have high-level PhDs, training, and been doing this work for generations, and really can be people that, and should be people that are hired, if not more, at least equally as outside consultants. Programs also need to be linked to incentives related, need to stop being related to issues of for-profit, or that promote this concept of the savior complex. It's very rare you're going to find anyone, whether they be African, Latin American, American, North American, European, anyone who does nonprofit is trying to help people have a better quality of life. They're trying to advance economic freedom, political freedom. It's good work. And everyone's got a little bit of savior in them. Because that's what motivates you at the end of the day. Just as Dr. Louis Picard said, this is not easy work. It's emotional, it's taxing, it's not for everyone. You have to have a little bit of positivity and desire and will to want to help others who are suffering in order to be able to make this into your career. But the problem is when it gets too much in any of this. And really what we've heard from Hanifa and from others is, you know, the issue that grants and the funding mechanisms, the way that we do donors, really means that large-scale international development organizations are more motivated by the size of their portfolio, as Hanifa called it, the quantitative impact that they're having. That's how they build their name. That's how they make sure that when a grant goes up, for what happens is the US or the World Bank or England will announce a grant, an RFP, a call, and all the agencies rush to compete for it. And they make these illustrious promises and they write the entire project in their office at Washington, D.C. with little to no input from their African or Global South colleagues about if this grant will even work, just to win it. And then they put in huge budgets to support, you know, the international staff with a lot less budgets. And I know I've been in charge of millions of dollars of programming and I've had hundreds of employees. And they're always always given less benefits. They are not paid even comparable when, of course, if you live in the US, you need to make $50,000 or $60,000, but you have some development experts that are making $200,000, $300,000 plus free housing, full benefits, free school for their kids. And then their African national director is maybe making $1,000 a month, maybe $2,000 a month. It is not even comparable when you look at the standards of living. And so really, it really does become this for-profit mentality. And then for people in the global South to advance upwards, like Dr. Joe did, and like Vijay has, and like Sakil Malik has, it's really for the one or two of them that make it up into higher levels in the nonprofits. They've left behind hundreds of colleagues still in those nations who are just as well qualified to be in those positions of power. There really is also this failure in national skill sharing and skills development. And this was talked about repeatedly from Hanifa to Vijay, Sakil Malik, Joe, oh my goodness, Patrick. I mean, it was off the hook how many people talked about this. And really the problem is that it's this dependency on the West to provide experts who really may not be the experts. They might have some expertise that are useful, but they're not the real experts. They're supplemental support, but they're put in as the person who's going to come in and save the situation. There's this dependency that they have to come in and provide the expertise. And some NGOs do a very good job of making sure, and a lot of government officials, and we saw this with Ebola, there was a lot of effort by a lot of agencies to make sure that whatever capacity was good and strong, like Patrick Foley and Declan T. Davis, they had the community engagement, they knew the problem, they were built up into higher positions, and they were given lead roles and resources they need to make a difference. But they needed some skills development. And so Patrick shared that, he was given management training. He was put into positions where he was coached by other colleagues in areas he needed. And there was a skills transfer. And now he is in charge by himself of his division in Prevail 3 and 4. Whereas in Prevail 1, there was still a lot of growth. But that doesn't always happen. And that's something that Dr. Obondo talks about a lot. That skill sharing, you don't even almost need to develop capacity. There are a lot of people in these countries that already have it. Like in Kenya, you have thousands of people who can apply for one position. And if they give it to a Westerner before giving it to a person on the ground, it's not taking advantage of the resources you already have in country, and then allowing them the ability to do what it is they do, and then two, keep growing their expertise. So there are agencies, there are African and Latin American colleagues like Dr. Matangwa and Dr. Ndiwu who've broken off and they're forming their own coalitions. They're really trying to promote consultancy groups that are driven by people from their nations. And I am a huge supporter because their work's incredible. Recognition of national partners' roles tend to be hidden. And we heard this, one of the most heartbreaking parts of this conference for me personally, and I've shared this openly with many of my colleagues, was hearing my close colleague and friend, Fidel Mark, talk about how he felt his ideas, his work was appropriated. And he doesn't even speak English as a mother tongue language. English is a second language for him. Actually, it's a fourth. He speaks many languages, like everyone in West Africa. And here he is using words like appropriated without even realizing the heavy terms that come with it in the United States and other countries where we do have systemic racism. And his ideas were taken. And then worse, his name wasn't even put on the final evaluation report. And it wasn't, he didn't get a pat on the back. He didn't get acknowledgement. He didn't get the credit he and his team deserved for their hard work and their ideas in the end. And this happens a lot. If you look at USAID programs, the reports, flip through the author section and see how many of the authors actually are the people in the global south who did the work, not the ones at headquarters, but the ones that actually were implementing the work and collecting the data. And that's very, very rare. So we need to be more careful to recognize our national partners' roles and not to take their ideas, but to share their ideas with them with their permission. And low transparency of solution impacts. There is, and this was said repeatedly, there is no accountability, especially for Western partners, about like what actually happened. So, you know, you get a $10 million grant, and you're an American international nonprofit, and you implement this project in X or Y country, maybe to stop sexual abuse or to get girls into school, and you do an evaluation, and then you give the evaluation to the donors without putting your African or your Latin American or your Asian colleagues' names on it, and then nothing happens. That evaluation just disappears to the donor. There is no dissemination. There's no feedback back to the communities about whether or not that program was successful or not. There's no feedback, as we experienced with the case in Benin. There's no feedback back to the ministry about how this went. And so that lack of dissemination, of transparency, becomes a huge problem. And then there's lack of accountability for foreign actors. And I am a foreign actor, so I take this to heart when I hear my colleagues saying this. There's little accountability for essentially when we foul up, when goals are not reached, when these huge promises, which we had seen earlier, are addressed, when these one-size-fit-all solutions fail or are not as impactful as they should have been because there was no flexibility in the grant and the implementation for culture and context. Who suffers for it? Well, it should be the boss. So if I am the person who's in charge of a grant and it actually doesn't meet its indicators, I should be the one who loses my job. But half the time it's actually then the African teams, the Latin American teams, or the Asian teams that lose their job. And that accountability for foreign actors, you know, what's your success rate on grants? That's not something you see a lot. Although a lot of charities, you can get online and go to Charity Star, and it will tell you, you know, how well a nonprofit implements its projects based on the resources it's given through money. You know, maybe it's a 4 or 5 star rating. That's great, but that doesn't really tell you how well they did on each project. And so I really did like Mr. Sakil Malik's suggestion of fully making accountable, transparent grants processes, where if a nonprofit gets a grant, they have to make the evaluation public. They have to have a third-party reviewer, preferably from that country, that actually evaluates to confirm and triangulate if what they said was the impact really is the impact. And so these are mechanisms that, you know, and letting your national staff get to see the actual grant budget and see how much they're being paid versus their white colleagues. Letting them see what you know, how much they have to spend on certain activities, getting to say if that grant is designed poorly and that maybe the money needs to be reallocated, reshifted to be better for more context, cultural specific implementation. These are the solutions forward. But we also need to be very careful and recognize, and you know, these are the words that came out from talking with the discussants, is the biased attitudes and the discriminant microaggressions that they experience. You know, people who are doing the work in their own home countries, their own regions, feeling like people treat them in a racist way or feel like they have different power dynamics, and that these biases come out through microaggressions that they constantly are having to undergo. Systemic racism and imposed processes that really do exist from the top down. And when you have a top-down approach, when you're running an international development organization with the international office being so much more important than the national office, and the national office having very little feedback up the chain of command, that is often systemic racism, because the national office 10 out of 12 times is going to be full of a higher percentage of people of color than the international office. And I've worked for 10 agencies. It's really about the case in all of them. Lack of accountability for authentic multilateral partnerships. And again, the word authentic, actual meaningful relationships built on trust, respect, accountability, and balance. And then finally, let's stop having these lofty, ill-defined foreign goals and solutions. This is not, and especially our African colleagues said, this is not what they need or they want. They want to be the drivers. They want to help identify the problem. They want to identify the solution. They would love input from their Western and foreign colleagues, their expat community. They're not asking us to stay out of their country. They love having us there. But what our value added is listening to them first, letting them take on management leads, letting them consult on design, letting them have the flexibility to change what they need to when it's being implemented, allowing them to participate or lead on evaluations, and then to disseminate that from the donor to all the stakeholders all around them. And if we can do that, maybe we'll start to see real sustainable progress in international development. Thank you so much. I would love to open this up for a Q&A if anyone wishes.